This viewer wants to know if surgical removal of a toenail is a good option for those who cannot take oral medications for toenail fungus. And the quick answer to that is that it depends. My approach is to take nail samples from the patient and to send them to the lab for identification of the organisms that are causing the infection. The lab will then give recommendations of medications that have been shown to be effective against that particular organism or organisms, as often it's more than one. One thing we have to determine is why this patient is not a good candidate for oral medications. Does the patient have a history of liver disease, such as cirrhosis or fatty liver or hepatitis? That automatically or almost automatically makes that patient not a good candidate for oral medications because the liver is necessary to clear these medications from the body. Has this patient used oral medications previously and failed to clear the infection? Some patients just choose not to take oral medications at all. Once it is determined why the patient cannot take oral medications for toenail infection, then we can determine what the other options may be. Removing toenails for toenail fungal infection is not an easy decision to make. First of all, if it's all 10 toenails that are involved, I am not removing 10 toenails from a patient. It requires injection of anesthesia into each toe, about 2 to 3 cc's for each toe, maybe double that for the big toe, depending on the size of the patient. And so that's a lot of injection. That's a lot of shots. And most people are not going to be able to deal with that in the office situation. What you must also understand is that removing the nail plate does not necessarily mean a cure of the fungal infection. The organisms are also underneath the nail plate or on the nail bed, the surrounding skin or the nail folds, or somewhere around the nerve root. So we must treat all of those areas. When we use medication, be it oral or topical, we're not actually treating the nail that we see that day. Any changes in that nail are permanent. What we are actually treating is the new nail that is growing in, and that could take several months depending on the speed of that patient's nail growth. So yes, I have surgically removed a toenail for fungal nail infection if it's just a single nail, maybe two nails, and if those nails are causing that patient pain and discomfort. Treatment will have to continue topically at the very least to prevent recurrence of the toenail infection. Thank you for your question and keep them coming, folks. Like this video with a big thumbs up and subscribe to the channel. Ring the bell so you will know when a new video has been uploaded. But most importantly, take care of your feet.